It's certainly an honor and a pleasure to be sharing the stage with Dominique and Dave and Jim. So I have no disclosures. So clearly this is a trick question. Our association, in concert with a couple of other associations, spent a lot of effort and time to create a consensus guideline regarding the resectability of hepatic colorectal mets. Chief among these guidelines is the issue of a R0 resection. So clearly I'm not going to stand up here on this stage and go against the association, or maybe it's an advertisement for a new consensus conference. We'll see. So the first question is the presence of an involved margin associated with prognosis? A little bit of historical perspective, and this is not to be critical of these studies from that time, because maybe their conclusions were appropriate for the time, but to take a little bit of a step back, probably the most important publication in this realm in the early era was that of Ahpba. And there was this criteria that became known as the Ahpba criteria that you'll see referred to in a number of publications on this topic. And what he and his colleagues did was to look at a patient population, again in the 70s and 80s, a small population compared to most of the series that we look at today. And in these 72 patients who underwent a resection for metastatic colorectal cancer, there were no 3-year survivors if they had greater than 3 lesions. There were no 5-year survivors if they had extrahepatic disease. And if you looked at those individuals who had less than a 10 millimeter margin, they had equally poor survival. And from this, he concluded that resection for liver colorectal secondaries is indicated when there are less than 4 tumors, even if bilateral, no extrahepatic disease is present, and a resection margin of at least 10 millimeters. And it should not be performed unless all of these requirements were met. So this sounds straight out of the textbooks from my era in residency, and probably fairly recently. Another important publication from thought leaders in this field was Blake Cady and Dave Linehan, who was a resident at the time when this publication came out. And in this publication, they looked at 244 patients who underwent curative surgery. This did include 20 patients who had cryoablation alone and 21 patients who had cryoablation of a resection margin, in addition to the remainder who had hepatic resection. This was a long span of patients, as best as I can tell from the publication.